This video is a quick review of maintenance of a chest tube. First, ensure that you have a clean, dry, and intact dressing. If the dressing is saturated, notify the provider. If the dressing is no longer occlusive, you may reinforce the Tegaderm. It is important to understand the reason for why the chest tube was placed. It will help you know what to expect. If the tube was placed for the pleural effusion, expect to see drainage in the tubing and in the atrium. You can milk the tubing, like so, to help the fluid move through the tubing and to ensure patency. If the chest tube is placed for a pneumothorax, you will expect to see limited drainage, but bubbling in this area is to be expected until the injury is healed. If the chest tube was placed for a pleural effusion, bubbling would not be expected and would be a reason to further investigate. You can see the policy for further guidance. Assessment of the atrium includes ensuring that the water level is at the 2 centimeter mark. Check your order, and if the order is to suction, ensure that the bellows here is expanded like so to the delta sign. Your order will dictate the level of suction, which is adjusted at the level of the atrium, not at the wall suction. You can change the suction with the roller clamp on the side. It is normal with patient coughing or deep breathing for the water level to rise and lower in the water column. This is called titling. If the white ball remains above the 0 mark when the patient is not coughing or deep breathing, you will need to release pressure by pressing this button back here. The atrium must be kept upright at all times and below the level of the chest tube insertion.